Today we are talking about cold and flu. It's obviously that time of the year, and I think that oftentimes, people will get their flu shot and they'll say, okay, I'm covered, and so on. And somebody will cough or sneeze, and they're like, what exactly is it that you're, dealing with right now? So I think the first question I want to kind of go through is, what are some of the telltale symptoms that people get, especially now with so many different respiratory symptoms? What are some of the telltale symptoms that you are dealing with a cold versus a flu?
Sure. Yeah, absolutely. It's a good question, and there's really a lot of overlap, to be honest with you. So they share some symptoms sometimes, and sometimes there's some unique symptoms. The cold flu symptoms might include fever, body aches, cough, runny nose, sore throat, and sometimes the flu can cause a sore throat, and you're not sure if it's strep throat or the flu. Sometimes a cold can be confusing with one of these things we can test for and treat. So it's important to try and figure out what's going on and make yourself feel better.
Wow. And then oftentimes with the flu, can you describe, because everybody thinks anytime you cough or if you have some kind of congestion, that is it. What should people know about, like, okay, no, this is actually something you need to go, get checked out. You're not just tired and you lost your voice and that's that.
Yeah, I mean, usually when it crosses the threshold, a fever would be an indication that it's something not only that is significant and also sometimes something that can be bacterial and can be treated with antibiotics. So a fever is probably one of the hallmarks that would allow you to make that decision. But also things like coughing, phlegm, anything that's causing you to feel winded or short of breath. If your body aches are significant, and also the duration. If it's something like a bad night's sleep, and you treat yourself well, you should be able to feel better. If it's lasting a few days, that's when you want to go get checked out.
I was going to say, especially with so many people who are like, well, I got the flu shot, therefore I'm covered. So, can you talk with us a little bit about when people get the flu shot? Is that foolproof? Are you all the way protected?
Absolutely not. It's very much like what we learned during COVID with the COVID shot. The flu shot does tend to make the flu last less long and the symptoms be more mild, but it's not 100% like nothing else and like everything else, and you can't be sure you won't get the flu. A lot of people do get the flu, even with the flu shot, and it varies from year to year based on the strain of the flu and what strain was used to make that year's flu shot. So it's usually in the 70s, 70 to 80% effective. But even if you do get the flu, most likely your symptoms will be less severe than if you didn't get the flu shot.
Okay, well, at least that's good to know, especially for those who did get the flu shot, for them to feel like, that wasn't a waste. All right, so what are some of the protocols that you follow in diagnosing and treating the flu?
Sure. It's really a comprehensive exam. It starts with the symptoms and that, you describe to the provider. Then there's a physical exam and vital signs, listening to the heart and lungs, percussing the sinuses to see if maybe it's a sinus infection versus a flu. And then we also have, at ExpressCare, we have, very high accuracy point of care tests. So we use PCR-based tests, much like you probably heard during COVID, and we can give you within 6 to 10 minutes a definitive diagnosis if it's one of the things we test for.
Oh wow, that's at least that's good to know, especially for people. And how do you approach educating people when it comes to flu vaccination? Because I even asked you, hey, if you get the flu, oh, are you then covered? How do you educate people so that they understand that, look, yeah, this is not 100% proof. However, here's what you need to know to protect yourself.
Yeah, I mean, we say that it's not 100%, but we do recommend everyone who's eligible for the flu vaccine to get the flu vaccine because young or old, as long as there's no contraindication, it does lessen the duration, lessen the severity, and hopefully it does protect you from the flu. So we're pretty universally recommending it to most of our patients. There's rare exceptions when it doesn't make sense or the patient can't get the vaccine, but for the most part, we encourage all of our patients to get the flu vaccine.
All right, and this one is actually a really good question. When should a patient seek medical care? Because oftentimes you feel like you have these flu like symptoms and you feel like, oh, I can't get out of bed. It's just so bad. But is that enough to seek medical attention or how far should you go before you seek it?
Yeah, so it's another great question. And there's variables. If you have a family member that's immune compromised or where something like COVID would be a significant risk to them, then you want to go get diagnosed definitively because that's important to know. Certain diagnoses have specific treatments and other ones don't. So at ExpressCare, we stock Tamiflu. We'll give antibiotics. We stock antibiotics if it's a bacterial infection that's amenable to antibiotics. And so if it's something that's persisting for several days, it's just not going away, you're not sure what it is, all those are good reasons, or you have a family member that's at risk if you were carrying something, all those are good reasons to come in and get tested, get a definitive diagnosis, and hopefully leave with a treatment that will knock out that bug or make you feel better.
Okay, that's absolutely good to know. And I guess with that, so when would like telemedicine be helpful in a situation like that? At what point, when it comes to cold and flu, are those, I guess I should say, are those the type of conditions somebody could be dealing with that you would encourage telemedicine with, or is it important? Is it more important to come in?
Well, telemedicine's always we offer telemedicine. It's always more convenient, obviously, to stay in your home and to schedule a visit that way. There's a lot of conditions that telemedicine lends itself to. If you have a rash or some telltale sign, a lesion in your throat, something like that, that the provider can see with their eyes, telemedicine's perfect for that. Many things they can diagnose just by asking you the right questions and hearing the responses. But also, if you know what you might have, we don't always have to test for it. If your child is homesick with a diagnosed flu and you have X, Y, and Z symptoms, we'll
You're like,
presumptively treat you for flu and consider it the flu if it makes sense and fits the mold there. So there's a lot of reasons why telemedicine is applicable, and it really does have its advantages in terms of convenience. So we recommend that you can always start with telemedicine as well if you're just not sure, if you want the provider's recommendation, and at ExpressCare we can transfer you, so to speak, if there's a need to be seen in person or get a certain test. You can start with a telemedicine visit and then just go into a local center for that swab or whatever it is.
and so for those of us who are just like, look, I just want to avoid the cold and the flu altogether, and not even think about it. What kind of preventative measures can people actively take to kind of keep it at bay?
Yeah, well, again, we learned a lot of these during the COVID pandemic. The number one preventative measure is to wash your hands frequently, and not to touch your face, because most of these viruses and bacteria transmit through your nose, and touching your face will get the virus or bacteria on your face. So washing your hands, not touching your face, wearing a mask if someone in your household is sick and coughing is always a good idea. And then there's general things like just taking care of yourself during the winter months. We're all inside. Viruses and bacterial infections rise during the cold season, and eating well, sleeping well, getting proper nutrition. We've started offering something at ExpressCare, which is a B12 injection, which is something that people can just come in and get. They don't need a prescription from an outside doctor for that. And that also is an immune booster. And some people get benefit from B12, regular B12 injections to prevent them getting the cold or the flu.
Okay, all really good stuff to know. And lastly, what role do you think urgent care centers like Express Care play during this cold and flu season? It's like you guys are there all year round, but specifically, it seems like, that is a high traffic time period.
Yeah, I mean, this is our season, so to speak. This is where we pretty much play a significant role for the communities. We are there for people when their primary care physician is unavailable. Either they don't have appointments, or it's after, 4 or 5 p.m., or it's a weekend, so off hours. We offer many of the same diagnostic tests that you could get from an emergency department. So we highly encourage people not to go to the ER unless there's a life-threatening or a very serious concerning symptom. But if you need a chest X-ray, we can do that at ExpressCare. If you
Okay.
need point of care tests for various infections, we can do that at ExpressCare. And we also, like I mentioned, have pharmacy services within ExpressCare, so you can leave with your medication if you need a prescription filled that we prescribe for you. So we're there kind of filling that gap between primary care and emergency care. And during cough and cold season, there's a huge number of people that fall into that gap. They can't get into their primary. It's really not an emergency medicine type of illness, and that's where we come in. We're convenient, we're fast, we have lots of locations, so that's kind of where we fill the gap.
Wow. Thank you so much, Dr. Thierman. I really appreciate it.